Hey, everybody. My name's Sean Lyden. I'm the chairman of vascular surgery at the Cleveland Clinic in Cleveland, Ohio. And I was one of the co-national principal investigators for the DETOUR2 study, which tested the DETOUR system with percutaneous transarterial bypass that was run by Endologics. So although we now treat over 90% of our patients endovascularly when they have femoropoliteal disease, in the setting of a long segment complex disease, our therapies are less than adequate. If we look at almost all the trials for both drug-coated balloons, drug-eluting stents, and nephrectomy trials leading to approval devices, most of those trials had patients with 10 centimeter long lesions, and they have great outcomes for 10 centimeter long lesions. However, when you start getting to very long lesions, 20 centimeter long lesions, the outcomes really become less than adequate. And so really that's an area of unmet need. And that really was the entire concept and design around percutaneous arterial bypass. The PQ bypass system, or the DETOUR procedure, is basically trying to do a surgical femoropoliteal bypass, but doing it through endovascular means. And so it requires contralateral access with an 8 French sheath on the arterial side, and it requires ipsilateral tibial venous access with a 6 French sheath. In essence, what you do is have to get into the origin of the SFA. So it has to have at least a 3 centimeter segment without a stent. And then you use a proprietary crossing device, the endocross, to cross from the superficial femoral artery into the femoral vein, and then pass down the femoral vein as our conduit, and then re-enter with that endocross device back into the distal superficial femoral artery or proximal popliteal artery. And then you're able to reline that segment with the proprietary covered stent, the TOR stent graft. And then you're basically creating entry in the origin of the SFA and then re-entry in the popliteal artery. So you're able to now bypass 20, 30, 35, 40 segment of SFA, so occluded stents, severely calcified lesions that you otherwise would be treating with the surgical prosthetic bypass. The DETOUR procedure using the PQ bypass technology has been studied twice. The first one was the DETOUR1 study, which was done in Europe, that looked at patients through 2 years. And then second was the DETOUR2 study that led to US approval earlier this year. So we combined those two patient populations to add power. And if you look at the patient populations in terms of the percentage of women, the lesion lengths, and the inclusion criteria, they were very heterogeneous, or they were very homogeneous and very similar. And so the outcome was to try and improve the number of patients we knew about this technology and how they have done. If we look at how we think about a surgical bypass, we know that duplex-derived evaluation, it's not super helpful, whereas endovascular therapy, it has been. And so if we look at whether the PQ bypass is open or closed, in 2 years, it has an 80% chance of being open, which is as good, if not better, than the surgical data that's out there for prosthetic fempop bypasses. When you look at duplex-derived restenosis, similar to other PTFE stents that are put within the femoropoliteal segment, it uses edge restenosis. That's what we saw in the trial. And if you look at within the trial, when you look at duplex-derived restenosis, as well as occlusions, the patency is around 62% at 2 years. The other thing you worry about is when you use the femoral vein as the pathway, does it lead to deep venous thrombosis? And the symptomatic DVT rate was only 4%. And in neither study did we see any pulmonary embolism events. So crossing through the femoral vein ends up being very effective as well as safe. So the big take-home message is this adds another unique tool to our toolbox for patients with greater than 20 centimeter long femoropoliteal lesions, patients that have severely calcified lesions, patients that have occluded stents. Instead of taking 3 or 4 hours to try and atherectomize, angioplasty, reline, covered stent within that segment, which is going to have really poor outcomes, we now have another thing in the toolbox to go around all that disease. The procedure can be done at about an hour, and it works just as well as a surgical prosthetic bypass without any of the morbidity. So right now, the product is being launched in the United States, and Endologics is working with the Society for Vascular Surgery through the Vascular Quality Initiative to create a post-market registry so we can continue to gain data about how this device is used, what are the outcomes and when it's used, and also within the VQI potentially compare those outcomes against commercially available other options that we use today, which we have seen inferior outcomes with. So we're hopeful that we'll continue to gain data on the PTAD procedure as well as how patients do.